Good afternoon, class. How is everyone doing today? This week, in week 7, we're going to cover emergency care and first aid, chapter 43 in your textbook of basic nursing. So emergency care, what is trauma? Trauma is a wound or an injury caused by an outside force. And thousands of people die yearly as a result of trauma and sudden illnesses. Trauma can be related to motor vehicle accidents, poisoning, burns, obstructed airways, gunshot wounds, etc., etc. What are the principles of emergency care? There is a Good Samaritan law in most states and provinces which require the nurse to assist at the scene of an accident in certain situations, and each nurse must be able to meet this obligation. On page 512 of your book, they talk about their box 43-1. Most states have a law that protects emergency care rescuers from legal liability, provided that their rescuers give reasonable assistance to the extent of training without danger or peril to the person or themselves. It also states some states consider rescuers guilty of violating the law if they do not give aid to someone who needs it. In general, if emergency rescue personnel are already on scene, you are not required to assist unless you are specifically asked to do so. And nurses are required to assist in an emergency only to the level of first aid training. Do only what you are trained to do in an emergency. So become familiar with the laws in the area in which you work, live, and travel. Principles also of emergency care. You want to assess safety. You want to be sure the scene is safe first before rushing to assist in an emergency. Also, do not move an injured person if the area or scene they're in is safe. And then you need to identify problems. Anything unusual that's going on. Was it an MVA where the airbags deployed? Is there a gasoline spill somewhere? Just identify any problems around. Also on page 512, the key concept. If there's any indication of foul play, treat the victim without disturbing what has now become a crime scene. We also have medic alert tag and alert system. ID tags are commonly used. They're used by more than 4 million people worldwide. It can be a necklace, a bracelet, it just depends on the type that they purchased. But it'll give you information, if they have diabetes, epilepsy, high blood pressure, as well as any allergies. Also, pacemakers. In some states, a do not resuscitate DNR order can be engraved on the emblem and serves as an actual DNR order. Also, people will put on their driver's license that they want to be an organ donor. However, remember that if a person dies, the next of kin must give permission for organ and or tissue donation, even if the person has been identified as a donor. There's also critical access standards, and these standards state that healthcare facilities are required to store all critical client-provided information in the permanent client record. And in addition, if the person is wearing emergency identification, healthcare and rescue workers are obligated by law to call for information if the client is unable to respond. If this system is not activated by the healthcare facility in an emergency, this constitutes a sentinel event or critical incident and must be reported. So we're going to do a triage. We're going to perform a triage. You know, triage is just it is a process of sorting and classifying to determine priority of needs. It involves determining life-threatening situations to see who we're going to assist which clients first. If there are many victims, you know, sometimes the less seriously injured people may be able to assist others, but it's also very important to identify victims and their next of kin whenever possible. Access and treat for shock. Shock is often the body's first phase of the alarm reaction because the body loses its ability to circulate an adequate supply of oxygenated blood. You know, shock most commonly is a result of inadequate circulation. So shock can be classified in three major categories. You have primary, which is the nervous system's response immediately after a severe injury or other traumatic event. You have secondary, which is 1 or more hours after an injury, perhaps up to 24 hours later, caused by blood loss. Not caused by blood loss. That caused by blood loss is a hemorrhagic stroke shock. So you have your primary, which is the nervous system's response immediately after a severe injury or other traumatic event. Your secondary is 1 or more hours after an injury, could be up to 24 hours later. And then your hemorrhagic shock, which is caused by blood loss. We have for hypovolemic shock, two of the labs that you want to monitor. And this is on page 515, is the serum electrolyte levels and complete blood count or hemoglobin. Just remember, if they're in shock, their hemoglobin levels may not drop right then, but you want to monitor their serum electrolyte levels and their hemoglobin levels. And then relative hypovolemic shock. Oh, I didn't do absolute hypovolemic shock. Absolute is excessive blood loss of about 1/5 of the body's total blood volume. It can result from severe dehydration, lowered intravascular fluid volume, diaphoresis, peritonitis, pancreatitis, severe burns. Relative hypovolemic shock is widespread vasodilation. Causes of that are massive infection or severe nervous system injury. Late signs of hypovolemic shock: lowered body temperature, shallow respirations, and narrowed pulse pressure. That is the difference between systolic and diastolic blood pressure. And hypovolemic shock sequel can lead to life-threatening conditions such as metabolic acidosis, irreversible cerebral damage, hepatic, and also renal damage. And then it can also lead to DIC, which is widespread clots mostly in the capillaries. So how do we treat shock? Shock is treated symptomatically. We're aimed at correcting imbalances. We want to look for changes in LOC. If falling, just remember, a falling blood pressure is a late sign of shock. And if we're in doubt, we're going to treat for shock. We can elevate their feet or lower their head. We can replace fluid loss. We could administer blood and blood components, meds, IV antibiotics. Signs and symptoms of shock, though, are a decreased blood pressure, an increased pulse rate, an increased respiratory rate, a decreased urine output, weak, thready pulse, and cool, clammy skin. Remember, for hypovolemic shock, you want to monitor hemoglobin and serum electrolyte levels. I already discussed the types of the major categories of shock, and that is on page 513. If you want to look at it again, it is it's in the paragraph just above hypovolemic shock. And then these types of shocks are listed on page 514. You can just read through those. So treating shock in an emergency. We want to keep the person lying down and as calm as possible. We want to establish, maintain, and monitor their airway, breathing, and circulation. We want to administer a high concentration of oxygen if available and assist with their breathing as needed. We want to control any bleeding and maintain their body temperature. You want to try to put something under the person. You want to keep them dry. You do not want to give them anything by mouth. You want to elevate the lower extremities unless it is contraindicated. You want to use the position that is most comfortable for the person you're treating. You want to immobilize fractures and monitor level of consciousness. Remember, monitor level of consciousness. And you also want to take and record vital signs at least every 5 minutes. So assessing a person in an emergency. Our primary assessment is we're going to identify any life-threatening problems or injuries. That your primary assessment can usually be completed within 60 seconds. The secondary assessment is where you will take and record vital signs and continue with a head-to-toe assessment. You might want to use the acronym ABCDE to help you remember the order for assessment. A is airway and cervical spine. B, breathing. You want to look, listen, and feel. For A, is your airway patent? You don't want to move that person unless there's an immediate danger, and you want to stabilize that cervical spine. B is breathing. Look, listen, and feel. Maintain that airway. Look for any life-threatening chest injuries because they can cause internal bleeding. Excuse me. Circulation and bleeding is C. Palpate pulse. Observe skin color. Reassess their breathing. Assess for progressing shock. And assess and control any type of hemorrhage. D is disability. It is a neurological assessment. Acronym is AVPU, which A is for alert, V is responsive to verbal stimuli, P is responsive to painful stimuli, and U is unresponsive. Another acronym that you may want to use is PERLA, PERLA plus C. PE is pupils equal, R is round, RL is react to light, A is accommodation okay, and C are coordinated. So remember AVPU and also PERLA plus C. Expose and examine any site of possible injury or any area that the person complains about. Sudden death and life support. So this is on page 519. Sudden death occurs when the breathing and heartbeat stop abruptly or unexpectedly. It occurs anytime breathing and heartbeat stop abruptly or unexpectedly. Causes of sudden death they're listed there on page 519. It can be related to anaphylaxis, drowning, near drowning, poisoning, shock, an MI, a CVA, etc., etc. Two definitions for death exist: clinical death and biological death. Clinical death occurs when a person's breathing and heartbeat stop. Sudden clinical death may be reversible with prompt action by people trained in basic and advanced life support. Biological death refers to the permanent damage and death of most brain cells due to lack of oxygen. Biological death is irreversible. So, know the difference between clinical death and biological death. Basic cardiac and advanced life support. BLS, or you can have BLS, ACLS. So, BLS, basic life support. Performance of CPR and use of techniques to clear an obstructed airway. ACLS, you can start IV lines, administer fluids and medications, use defibrillation and cardiac monitoring, administer O2, opening and maintaining the airway, and sometimes intubation. Code in a healthcare facility. Cardiopulmonary emergency, you want to call Code Blue or Dr. Blue. I've never heard of it called Dr. Blue before, but your book has that. But remember, usually code in a healthcare facility is Code Blue. You want to obtain your necessary emergency equipment. If it's pediatric, some of your code cards may be equipped with a color-coded resuscitation tape, which is called the Broslow tape, and that is used for pediatric emergencies if you do not have a correct weight. You can assist the code team. You have mechanical ventilators, IV therapy, vasopressor drugs. Those all may be needed to maintain the client. And you'll be moving the client to they'll either be in the ER, or if they're on one of like the med-surg floors, you are going to move them to an ICU for closer observation, and you are going to document everything that you've done. So remember, document, because it doesn't, it wasn't done if you do not document. First aid measures. Chest, back, neck, and head injuries. Do not attempt to move or transport. Supervised cautious extrication. Chest injuries. Stabbing, shootings, and MVAs are the most common causes of chest injury. A wound that penetrates the chest requires immediate first aid because air is allowed to enter the chest cavity, which disrupts the normal vacuum within the chest and collapse the lungs. And the lungs cannot adequately expand, which is called pneumothorax. If a pneumothorax is present, seal the open wound in any way possible using Vaseline gauze. If there is a pneumothorax present, seal the wound using Vaseline gauze. Back and neck injuries. Suspect back or neck injuries if a person falls or they have been in an MBA. And use immobiling devices. I'm just going to go back here real quick to the chest injuries. Just remember, never remove an article puncturing the chest, because that article will help seal the hole, and its removal may cause additional damage. Surgical removal is necessary under controlled conditions. And then we have head injuries. Head injuries, we want, the scalp is really vascular, and, scalp lacerations bleed profusely. But we want to, with head injuries, we want to observe for blood or fluid draining from the nose or ears. We want to keep the person warm, and we want to check for increasing intracranial pressure, which a sign of that could be persistent vomiting. So remember, any person who has had a head injury, no matter how minor, should be observed carefully for at least 24 hours because late complications can occur. Remember, if they have persistent vomiting, it could be a sign of increasing intracranial pressure. Cold-related injuries. Frostbite is freezing of body tissues due to cold temperatures. The body is most vulnerable to frostbite when there's high wind. Most likely to be affected are your hands, feet, nose, ears, and cheeks. Do not rub frostbitten parts to restore circulation. Do not rub frostbitten parts to restore circulation. Frostbite is often treated like burns. Immersion feet. That are feet that are kept in cold, moist boots for several days. You want to gently warm them, keep them clean, dried, and elevated. You will see that a lot in hikers or canoers. They a lot of times will give antibiotics as well as a tetanus booster. And then hypothermia. That occurs when the body loses heat faster than it can burn food to replace it. Hypothermia is caused when a person is exposed to extreme or fairly extreme cold or is chilled sufficiently long to lower their core body temperature to a dangerous level. If they're rewarmed too quickly, the cold blood returns to the heart, causing severe dysrhythmias and sometimes cardiac arrest. So you want to monitor for cardiac dysrhythmias. You want to remove and replace all wet clothing, and you want to provide warm oral fluids if the client is alert. Now remember, if the client is alert, you can provide warm oral fluids. Warm fluids help better than hot beverages. You also can warm your O2 and any IV infusions, and you want to monitor them carefully. So remember, with hypothermia, we're going to monitor for cardiac dysrhythmias. You want to remove and replace all their wet clothing, and you want to provide warm oral fluids if the client is alert. And also, the biggest thing, rewarming is you want to rewarm them gradually, because if they're rewarmed too quickly, cold blood returns to the heart and can cause severe dysrhythmias, sometimes cardiac arrest. Heat cramps. Heat-related injuries. You have heat cramps, which are severe muscle cramps or muscle spasms after hard exertion. Heat exhaustion is exertion in a hot environment over a length of time. And remember, a parked car can quickly become a fatal enclosed area for children and pets because of radiant heat produced by the sun. And then we also have heat stroke, which develops rapidly and requires immediate attention. So for heat cramps, they're sometimes relieved by drinking a very dilute salt solution, or like sports drinks like Gatorades. Salt tablets are not recommended because they are irritant to the gastric system. And so, a lot of times you just have to teach somebody to add just a small amount of salt to their food before exertion. and to stop exercising if they feel ill. Heat exhaustion can occur, in physically fit people who are exerting themselves in a hot environment over a length of time. Pure forms of heat exhaustion are rare. Most generally, it's related to water depletion or salt depletion heat exhaustion. Treatment for heat exhaustion includes cooling the person without chilling them. And if their blood pressure and pulse remain low for more than an hour, you might want to suspect heat stroke. Heat stroke can be a potentially life-threatening condition. And that heat stroke is when a person's core temperature reaches 105 to 110, sweating stops, brain cells become damaged or destroyed, and death results. External heat stroke develops from an increased internal heat load. Individuals with classic heat stroke are usually brought to the healthcare facility because of hypotension, not hypo, fever, and coma. Persons with external heat stroke are usually brought in because of their bizarre behavior, confusion, or collapse. So first aid treatment for heat stroke includes rapidly cooling the person to at least a temperature of 101. You can put them in a cool, shady place, remove their clothing, and wrap them in cold, wet sheets, or spray the body with, like a cold mist. Also burns. Burns, you can have sunburns, inflicted burns. So, there's a lot of different types. The most common emergency cases of burns are caused by thermal, electrical, chemical, and radiation. Thermal burns are flames, steam, hot liquids, and hot objects can cause thermal burns. Electrical power sources or lightning can cause electrical burns. Strong chemicals can cause severe chemical burns, and radiation burns, power plants, nuclear sources. But remember, sunburns also fall within the radiation burns. You can get sunburned by a sun lamp, or a lot of individuals think that they go tanning, they think they can't get burnt, but there is always that possibility. So inhalation injuries. This is on page 526 and 527. So first aid for other types of burns for inhalation therapy. They may have burned or singed nasal hairs or burns in or around the mouth. They can have flecks of soot in their saliva. They can have a smell of smoke on their breath, and their voice will be hoarse. And remember that a person can experience a burn internally, such as inhaling hot air or smoke, or from swallowing a caustic substance. So if a person was trapped in a confined space and exposed to chemical or smoke, suspect smoke or heat inhalation injuries. Drownings. Suffocation from submersion in liquid. Recovery has occurred after submersion. You want to initiate and continue life-saving measures. And because the thing of it is, victims of near drowning may appear dead because of reduced brain and cardiovascular function. However, you should initiate and continue life-saving measures, including CPR, until the person can be evaluated by an electroencephalogram, particularly children, because they can respond to prolonged resuscitation efforts without sustaining brain damage after a near drowning. So, like I said, and the electroencephalogram, you want them to be evaluated with one. So victims of near drowning, may appear dead, but you want to initiate and continue those life-saving measures. Musculoskeletal injuries. Remember RICE, rest, ice, compression, and elevation. Remember RICE, rest, ice, compression, and elevation. You can splint an injury if there's a fracture of the wrist, knee, or elbow is suspected. Splint the joint in its existing position. You can dress any wounds, use bandages. You can apply cravat bandages and slings. You can use a triangular or handkerchief bandage from a square of cloth. They can also be used to make a sling for an arm support. So a lot of times, you're going to use what you have available because not everybody has all of this stuff available all the time. So, use what you have available. But also, if it is, if you are using a type of bandage, always make sure that you can try to leave the person's toes, their tips of their toes and fingers exposed so you can check for impaired circulation. So just, make sure that you think about that. Dental injuries and missing teeth. Intrusion injury that's where a tooth is pushed up into the socket. And then also you have an avulsion injury that is where a tooth is knocked out and immediate dental care is necessary. Foreign objects is any abnormal object or substance lodged in a body orifice or structure. Contacts, if you have contacts in, you want to remove them, especially if you have an injury to your eye or have a foreign object in your eye. Nose, you want to blow your nose gently with both nostrils open. Ears, don't attempt to remove it because most generally all you're going to do is shove it down there even further. And then, of course, airway obstruction, you can use the Heimlich maneuver. And then cardiovascular emergencies, you have fainting, which is syncope. And syncope is caused by an insufficient supply of blood and oxygen to the brain. But extreme hunger, tiredness, heat can also cause fainting. And then you have myocardial infarction or heart attack. And that is caused when the heart's blood supply is cut off, causing the heart muscle tissue to die. So what are we going to do for first aid if we suspect someone? The one thing I don't see bleeding, the thing before bleeding is suspected cerebral vascular accident, which is on page 531. I don't have a slide for that one. But remember fast, face drooping, arm weakness, speech difficulties, time to call EMS. And bleeding, epistaxis is a nosebleed. In case of a fractured skull, do not attempt to stop the bleeding. Because if a person with a nosebleed has a fractured skull, doing so can increase the intracranial pressure. And then minor bleeding, you can place a sterile pad directly over a minor wound, or you can use an adhesive bandage strip as adequate for a small cut or scratch. Hemorrhage we had talked about earlier is bleeding that is abundant or uncontrollable. Is it capillary bleeding, arterial bleeding, venous bleeding? You want to apply direct pressure in external hemorrhage, indirect pressure if the direct pressure does not control the hemorrhage, and you can also use a tourniquet on an extremity over a pressure point. So with capillary bleeding, think about it, the blood oozes out slowly. Arterial bleeding, the blood comes out in spurts with each heartbeat, and it's bright red or pink. Arterial bleeding is usually the most severe type of hemorrhage. And then in venous bleeding, the blood flows steadily and is dark in color. Venous bleeding is usually minor and stops by itself unless a person has a bleeding disorder. Anaphylaxis. Type 1 allergic life-threatening reaction. So with anaphylaxis, it can occur within minutes of exposure and is immediately life-threatening. Anaphylaxis is a true medical emergency and time is crucial. That is on page 533. It is a nursing alert, and just below that nursing alert is another one. Usually the faster an allergic reaction occurs, the more severe and life-threatening it is. With anaphylaxis, you want to remember the acronym SIRES. Stabilize, identify the toxin, reverse the effect of the toxin, eliminate the toxin, and support respiration, circulation, etc. Remember, the first thing we're going to do is stabilize and identify the toxin, because we can't reverse the effects of the toxin until we know what the toxin was. Animal bites and scratches. Rabies is a communicable disease transmitted through animal bites. You can have cat scratch disease. Do not delay in obtaining medical care, because some scratches and bites may cause you may have to have oh goodness gracious, brain dead. They may have to do surgery. Not only that, you want to follow your healthcare provider's orders for further care. They may need to have a tetanus injection or antibiotics to prevent or treat the infection. Especially with, cat and dog infections, but a cat bite disease can be more serious than a dog bite. So just remember that a cat bite, can be more serious than a dog bite. And then also too, they may, if it has in an animal bite, if they capture it, they may keep it in quarantine. But if they don't, they may give prophylactic rabies shots. And then exposure to hazardous material. Primary exposure is a person was exposed directly. Secondary exposure is a rescuer is exposed to contaminated person. Precautions, you want to wear PPE to help prevent secondary exposures. You want to decontaminate the victim. And poison is any substance that threatens a person's health when it is absorbed or comes into contact with the body. So, in an emergency, swiftly remove an article puncturing the chest. If it's still in place, we want to do that? No. And then factors present in psychiatric emergencies. Think threat to harm self or others, suicidal thoughts, history of prior suicide attempts. Remember, threat to harm self or others, suicidal thoughts, or history of prior suicide attempts. Refusal to talk, severe depression. intoxication or drug abuse with violent thoughts, self-injurious, out of control, or bizarre behavior, evidence of self-harm or not caring for oneself, and reports of any of the above by family or neighbors. And here's your answer to that question. Do not remove an article puncturing the chest if it is still in place. That article will help seal the hole. And then this here, I just threw this slide in, signs of increased ICP, confusion, disorientation or agitation, loss of memory, any change in vision such as blurred or double vision, decreased LOC or difficulty arousing. They may be extremely lethargic, numbness, tingling, weakness in an arm or a leg, severe headache, and speech problems or seizures. That is the end of chapter 43. And next week we are going to cover chapter 39, which is chapter 39 is emergency preparedness. And your last quiz in Nursing 401 will be over chapters 39 and 43. Have a great week, and I will see you guys next Monday.